All right, hello. My name is Dan Stevens, and welcome to the affirmative side of the debate for universal health care in the United States. Um, I've tried this a couple of times, trying to get under 8 minutes, so it's the advantage of doing it by video. Let's try it again. Um, Audience ready? Judges ready? Singapore has established strong fundamentals in healthcare excellence by having a universal healthcare system, having established the world's fourth best healthcare infrastructure, according to World's Competitive Yearbook 2010. While spending less than 4% of GDP on healthcare and providing universal coverage for Singapore with multiple layers of care. The standard of medical practices ranks among the best in the world. The Joint Commission International has accredited 11 hospitals and 3 medical centers in Singapore, and is the world's third lowest infant mortality rate and the seventh highest life expectancy, according to Global Competitiveness Report 2009 to 2010. I am here to stand for universal health care system such as Singapore's to be adapted by the United States of America. According to the Institute of Medicine, one of National Academy's sciences of the United States government, the United States is the only wealthy industrialized nation that does not ensure all the citizens have access to health care as part of a universal system. Starting off, I would like to define the grounds of the debate. We are discussing universal health care and not single-payer health care. Universal health care refers to where everyone is covered for basic coverage or basic healthcare service, and no one is denied care as long as they are a legal resident of the United States, like examples of every citizen in the country of Canada. The concept of universal health care is often incorrectly equated to single-payer government healthcare system, where all healthcare is paid for by one entity, usually being the government. However, single-payer and universal are not the same. So, for the criteria, how come the U.S. is fighting to keep people insured? As the affirmative in this debate, I am here to say that every person in America should have health coverage, and it is their right. According to the U.S. Census Bureau, there were 46.3 million Americans without health insurance coverage in 2008. That's 15.4% of the U.S. total population. In contrast, there is zero, as in zero uninsured Canadian citizens due to their government-run system providing universal coverage. Moving on to contention number 1, non-universal medical costs. Universal care to all Americans would improve public health and reduce overall health of healthcare spending. No one in the richest nation on earth should go without healthcare. A June 2009 poll shows that 64% of Americans say healthcare should be a right. My first subpoint is that 62.1% of American bankruptcies in 2007 related to medical expenses. Approximately 78% of medical bankruptcies were filed by people who had health insurance. If health care was a right, and Americans would eliminate spending on medical bills by being able to place the money elsewhere in the economy. And moving on to the second subpoint is that healthcare premiums have risen 3 times faster than wages. Workers are shelling out over an average of $4,565 for their employer-sponsored family healthcare coverage for the year of 2013. According to the annual survey conducted by the Kaiser Family Foundation and the Health Research of Education Trust, the total cost of healthcare, including both for workers and employees, share rose 4% for families. For individuals, they rose in tandem according to the same survey. While health insurance costs have been rising more slowly in recent years, so have wages. Workers saw their income rise by only 1.8% over the last year. Healthcare prices, wages. Hard to pay for this with this. So, and the sad part of that is that the year premium increase was the second lowest since Kaiser began conducting the study in 1999. A decade ago, increase were more than 9%, had actually happened commonly per year to year. During the second presidential debate on October 7th, 2008, U.S. President Barack Obama, a candidate at the time, said, "Healthcare should be the right of Americans." In his June 15th, 2009 speech delivered to the American Medical Association, President Obama stated, "Make no mistakes, the cost of healthcare is a threat to the economy. It is an escalating burden on our families and businesses. It is a ticking time bomb for the federal budget, and it is unsustainable for the United States of America." Moving on to contention number 2, my final contention for the debate today: overall health of the citizens. First, I had stated before, Singapore offers the world's 4th best healthcare, 3rd lowest infant mortality rate, and the 7th highest life expectancy due to healthcare. For Americans, this has resulted in Americans having very poor healthcare to overall developed nations. Of a group of 27 compatible high-income democracies, the United States tied with countries such as Hungary and Slovakia as having the highest infant mortality rate and ranked 23rd of the 27 in life expectancy at birth in 2007. Out of the 193 member states of the World Health Organization, the United States ranked first in per capita healthcare expenditures and 31st in life expectancy, that's 78-year average lifespan, and 152nd, in infant mortality rate. That's 6 deaths per 1,000 infants. Second subpoint of contention number 2. With universal health care, citizens can get free treatment for basic conditions without a fear of not being able to afford them. This can be reduced the spread of infectious diseases and other common health problems that people may ignore if they cannot afford health care. By being able to go and get treated right away for the basic issues, this will bring down the overall cost of medical expenses, since the basic issues will be treated prior to reaching more expensive issues. This leads to better overall health and of the overall nation. To summarize, the cost of premiums of private insured continuously rise as the rate of wages increase cannot keep up with them. This will only hurt the economy even more, leaving little residual income for people to circulate in other places that medical and insurance expenses. By adapting a universal healthcare forum, the overall health of everyone in America will benefit from overall health. Thank you. Wow, that's a mouthful, trying to spit that out real quick. All right, well, thank you guys for listening to my affirmative side of the speech, and good luck to the partner that I get paired up with, and it should be interesting debating back and forth with you. Take care.